we focus on root cause, and we know so much of that has to do with the oral microbiome.
That's right.
And the gut microbiome. Hormonal imbalances,
Mhm.
cortisol imbalances impact salivary health. Salivary health impacts dental health. Like, it's all connected.
For someone who has just for the first time heard that word functional
Mhm.
dentistry, right, which is still kind of a novel concept, you hit on this, you're looking for the root cause. But what are some of the core differences? If you were to list 2, 3, 4 differences of a functional dentistry practice versus a traditional dentistry practice, what are some of the core differences that you'd find with a functional dentist?
So functional dentistry should be thought of as part of functional medicine. And in my opinion, that means the dentist needs to be trained in functional medicine. And
Mm-hmm.
that's what I believe dentists are missing. We're missing the medicine part. We're missing what our physician colleagues, the education that they went through. So the
Yeah.
hormone pathways, the gut
Mm-hmm.
health, let's learn about gut mapping and how to run these tests and diagnose them and interpret them. And then what strategies do we implement? Immune health, cardiometabolic health, bioenergetics.
Mm-hmm.
We barely get medical training in dental school because we're so focused on clinical training, like
Right.
fixing teeth. We're like little mini surgeons, but we
Right.
miss this huge component about how tied in oral health is to the rest of the body. So
Yeah.
I strongly believe a proper functional dentist needs functional medicine training.
Mm-hmm.
And there aren't many out there yet doing that, but we're trying to change that. So I have co-founded the Institute for Functional Dentistry, and
Cool.
we're allied partners with the Institute for Functional Medicine, which that launched in the 1990s. It was Dr. Jeffrey Bland's beautiful vision. He was the one that really coined functional medicine.
Mm-hmm.
And so he's such a wonderful thought leader. And then, of course, many people have heard of Dr. Mark Hyman.
Mm-hmm.
And so we're following in with the Institute for Functional Medicine as allied partners, where dentists can go and they get their functional medicine training,
Yeah.
and then they get functional dental training where they can
Very
get the
cool.
subspecialties. So specifics to nutrition and oral health, or pediatric dentistry, or
Yeah.
endodontics, root canals, or oral surgery, implants, orthodontics, airway, all the things we did in dental school. Literally, it's a residency level program, but through a functional medicine lens. And they have
Yeah.
to take that functional medicine training first. And I do have my certification through IFM. I'm one of the only
Mhm.
dentists in the world who went through that. And I'm going to be very honest, it was the hardest
Yeah.
curriculum and tests I have taken, because we just aren't exposed to this level of medicine in dental school. So
Mhm.
I think we're at the forefront of this big shift, and many of us. I want to make sure I'm clear. I'm not. There's many of us out here pushing for this.
Yeah.
I'm one of an army,
Yeah.
and but we need to get the mouth back into the body. And while
Yep.
it's really important that there are dentists out there that are more technicians, I would say, or surgeons, because we do need to fix teeth, we
Yep.
really need more dental physicians. And this is where the oral microbiome
Mhm.
comes in. So when you said
Yeah.
what are some things that are different, we focus on root cause, and we
Mhm.
know so much of that has to do with the oral microbiome
That's
and
right.
the gut microbiome. Okay. So
Yeah.
let's just say the microbiome,
Yep.
as well as nutritional deficiencies and gene SNPs and airway health,
Mhm.
hormonal imbalances,
Mhm.
cortisol imbalances impact salivary health. Salivary health impacts dental health. Like, it's all connected. Okay. And we can dig into what seems appropriate, but it's really looking deeper, and it's looking more at the human as a bio individual. So dentistry really does tend to treat everyone the same. And we need to start creating more personalized medicine, including with our oral health. So that's a quick synopsis, but the program launches in January. So I'm very confident in a year or two there
Yep.
will be so many more dentists out there practicing this way. I think it's going to happen very quickly. And then there will be a database where patients can go and find a dentist near them that's thinking and practicing this way, but with the proper certification as well, which is important. We need some standardization. That's how we move forward, and that's how we're taken seriously by other colleagues too.
Functional dentists are really hard to find. They really are. I mean, I was doing some searching before
Yes.
this and it was like, man, I mean, where do you even start to go and how do you look for them? When you're talking about getting as upstream as possible, things like, airway health, what are some of the things that you're looking for in children specifically as a functional dentist that a traditional dentist wouldn't be looking for in children?
Well, not to overwhelm,
Yeah.
but the where it really starts is preconception.
Yep.
So, not all of us have that luxury of pre-planning some things in life, but
Mhm.
making sure the terrain is optimized before we conceive is ideal, and that includes one's gut microbiome and oral microbiome and vaginal microbiome, etc. And this is for both partners. Taking care of any dysbiosis in the mouth or the gut, because your baby receives information from you, and we know now too they receive the microbiome in utero from the mother
Yep.
to some degree.
Yep.
We didn't realize that until fairly recently. And then certainly how you give birth impacts
Yep.
things. What are the medical interventions? And I'm not advocating for anything here. I'm just saying, is your child put on antibiotics? Are there a lot of
Yep.
outside environmental factors that are influencing them? Were they premature? Were they in the NICU or the PICU? Are they breastfed? What's the health of the caregivers around them? Because we know as tribes we exchange our microbiomes.
Yep.
So that's how upstream I get in my practice. And my patients tease me because my intake form is like a novel and it takes them
Yeah.
a long time to fill out. But then after they kind of hem and haw about it, I think they see how it's different, the
Mhm.
things I'm asking them. And it's also important, what are the environmental toxins and exposures of the parents and the baby?
Yeah.
And that isn't just heavy metals, it's also mycotoxins. What's the nutritional status of the mother while she was pregnant? Was she vitamin D deficient? Was she mineral deficient? What was her stress level? Did she have a lot of stress? Did she have airway issues? Does she
Yeah.
have sleep apnea? So that's so important because it does set the
Yeah.
child up on this trajectory. But then, of course, we start in infancy, and we look at how the baby is feeding,
Mhm.
how they're sleeping, their posture. Do they have torticollis?
Yeah.
We work a lot collaboratively with craniosacral therapists, osteopaths, chiropractors, because that's neurosensory integration, which is all very important too for how we breathe and how we swallow and how we chew, and of course, just our general mood and behavior as we age. Food introduction is so important. Was the child breastfed? How are they breathing? Are they mouth breathing? Are they nasal breathing? Do they snore? Um, what foods are introduced to the child? Are they on a whole food diet mostly, or have we shifted to now the standard American diet, the ultra processed foods, the goldfish crackers, the chips, the pretzels, the granola bars, the gummy fruit snacks? This all influences. So you'll hear people say the first 1,000 days, it's the
Yep.
first 3 years of life,
Yep.
are profoundly impactful for a child's health trajectory for the rest of their life. And again, I like to share this education not to overwhelm, because if you
Yeah.
have a 7 or 8 year old and you're looking back, I don't want any parent or specifically mom guilt, but this is important to share so that we can, when you know better, we can do better for future generations too. So those first 3 years of life are really powerful for the microbiome.
I'm so glad you brought that up. That's an area of research I personally have just been fascinated with for years. And then obviously bringing it into gut microbiome health. But the first 1,000 days of life, for anyone who's maybe hearing this concept for the first time, is the most profound window of opportunity that we have to impact human health.